Hello, this is Dr. Uday Thanawala, a gynecologist practicing in Vashi, Navi Mumbai. Anybody who plans to have a baby wants ultimately a healthy baby, a smooth and pleasant pregnancy, and a relatively easy delivery. So how does one go about achieving this? Well, there are two components when you talk about a healthy baby. One is the preconceptional part, the part which you do before you even conceive. And once you conceive, you undergo a series of antenatal checkups and antenatal care and exercises, which will lead you to a very good outcome. So we're going to talk about it in different series. Today's talk just concentrates more on the preconceptional part. And we feel that every normal couple also needs to visit a gynecologist once they plan to have a baby for a preconceptional counseling. What do we do in a preconceptional counseling? Well, we generally look at your overall health, your lifestyle, and we run a certain amount of blood tests to make sure that things are normal and to guide you on how to go about conceiving. In your general health, we look at what your health is like if you're obese or you're overweight, your BMI is more than what it should be, then it's a good idea to probably first lose some weight and then embark on a pregnancy. Why is this? Because it is known that women who are obese or whose BMI is more than around 27, 28, they have problems during pregnancy, like increased incidence of abortion, increased incidence of developing diabetes or blood pressure during their pregnancies. So it is good to get on to lose some weight and then conceive. It also holds true for the male partner because obesity can affect the sperm count and you may find it a little difficult in getting pregnant. So basically we look at the general health of the couple. We of course measure your blood pressure and do certain amounts of tests to figure out how your other systems are working. To improve your general health, you have to get on to a regular exercise schedule also. Basically, it is eating healthy and having a healthy lifestyle. Exercise helps even people with a normal weight because it sets a lot of hormonal milieu correct inside, and you get better reproductive outcomes if you are an active lifestyle, eating healthy and doing a bit of exercise. We also look at your lifestyle because in case you have addictions like smoking or any other form of tobacco, hookah or gutka, whatever it is, it's a good idea to decrease it or give it up totally. Because once a woman conceives, we definitely say tobacco is a big no-no. But even in the preconceptional period, it can affect the quality of the eggs which a woman produces. And in the male, it can affect the sperm which the man produces. So smoking is something definitely which needs to be drastically cut down or given up totally in the preconceptional period. The same holds true for alcohol. What about tea and coffee? Well, there are no absolute contraindications of not having tea and coffee, but of course even their intake has to be limited. A woman who conceives, it is recommended that just 2 cups of caffeine are good enough, not more than that. So one has to remember that these addictions, everything needs to be in moderation. Once we look at your lifestyle and your general health, we order certain blood tests which needs to be done in the preconceptional period, and this is for both the partners, the wife and the husband. We need to know both the blood groups, we need to know what the hemoglobin is. We run an infection screen for HIV, hepatitis B, hepatitis C and VDRL. The idea of running the screen is that if anything comes positive, one needs to protect the partner and the baby which is going to come from passing of these infections, because these infections can be transmitted in utero. The other blood test which is done is a regular thyroid profile because we have a high incidence of hypothyroidism or thyroid disorders in our population. And very importantly, we need to do the blood sugar because even the incidence of diabetes is very high in our population, even in the younger age group. Suppose any of these tests do come positive, like suppose the blood sugar is high, and if you are proven or you already know that you are a diabetic, in that case one needs to restrict the sugar intake, get the diabetes properly under control, And this is important in the preconceptional period because a known diabetics, what we call as the HbA1c, should be below 6.2, because higher HbA1c or a sugar which is not under control and the woman becomes pregnant, there is a higher incidence of congenital malformations. So it is important to screen for these diseases and treat them. Suppose you are a known hypertensive, then your hypertension dose needs to be adjusted. You need to be screened for any other kidney issues which you could have, or ophthalmic issues which you could have. That means eye disorders if you're a hypertensive, before you embark on a pregnancy. So basically, any known disease, yes, definitely preconceptional care is very important. But even normal couples need to have this in mind, that a preconceptional visit is a very important part of planning a baby. Do you need to take any supplements during this period? Yes. One supplement which is known to prevent congenital malformations or neural tube defects, that is disorders of the spine in the baby, is folic acid. And we put all women who are planning to conceive on a prophylactic dose of folic acid. It's a small little tablet, a 5 milligram tablet per day is enough. Do you avoid anything? Yes, besides the toxic substances which we have told you. One preparation, retinol, which is present in many of the anti-acne creams. It is a vitamin A derivative, but retinol is something which we don't want you to use in the preconceptional period because it is known to harm the fetus. So please see the creams which you use. If it has got retinol in it, please avoid those creams. Besides that, have a healthy lifestyle, eat healthy, do exercise, and have a positive approach when you are planning a baby. Preconceptional care is important, as we've elaborated, and it saves a lot of problems during the pregnancy. It makes sure that you have a healthy infant, that when you conceive, you have a healthy conception, which leads to a healthy baby. So everybody who's planning to have a baby, do definitely visit a gynecologist for a preconceptional consultation. Get the test done, get yourself examined, rule out any other possibilities which can create a problem in future, and that will go a long way in ensuring you to have a healthy baby. Thank you.